så tycker jag.
It's supposed to be slimy. Hey everyone, this is Abby, your favorite hygienist here at Tooth Time. But you know the drill. Go ahead, like, subscribe, and comment below any content you like to see. Let's go ahead and get started with this next video on taking off somebody's braces. So this patient is going to get their braces taken off. They had their braces on from March 2021 to October 2022. So about a year and a half with good elastic wear, consistent appointments, great diligence. Your time frame in braces could definitely shorten if they told you it's maybe going to be 2 years or a little bit under. So you always have to remember whenever you come in to take off your braces, it's always going to be a process. Sometimes taking off the braces is quite quickly as opposed to afterwards. The aftermath is removing the glue and making sure everything is nice and shiny. So with this patient, we're going to go ahead and take off the molar brands. So it's the little rings around the tooth. It's going to leave some blue residue after we remove it. And we're going to remove the bracket glue by using our white burr. And then we're going to go ahead and polish everything off to make sure that there's no residue left. We're going to go ahead and remove any of the blue residue glue that's on the molars. Remember, that's the Fuji glue that we use to band the molar bands. Make sure that that is completely taken off whenever you get your braces off, because sometimes it can cause some irritation to your gums or in between your teeth. So after we remove all the glue and the residue that's left, we're going to just go ahead and polish some of that plaque or bacteria that's around the gingiva that irritates and causes inflammation. Remember that sometimes whenever you're in braces, you always have to brush your teeth, you have to floss, and definitely use the recommended products that we recommend, like your water pick, your electric toothbrush, as that is going to go ahead and avoid any inflammation, any plaque buildup, any calculus buildup, and also some demineralization, which is some white spots around your teeth, which sometimes whenever you get your braces taken off, you'll notice that there's like a white outline on your tooth. And it's usually because the plaque sat so long on the teeth that's caused them to get white spots. So remember, the solution to avoiding any white spots is really just brushing. Good oral hygiene and home care is going to definitely reduce any of those white spots or avoid getting that. The white spots will soften your enamel and you're more prone at a high risk of getting cavities. And usually when you're in braces, you're quite young, so you have to think about you have your whole life ahead of you of having these teeth, that you're never going to have any new ones replaced unless you get any other restorative work done. What I mean by restorative work is getting any fillings, crowns, that maybe your tooth is non-salvageable at the point because it's decayed past that point. So remember, a recap: brush your teeth, floss, use your water pick, use your electric toothbrush, use your tooth bristles. This is going to help avoid demineralization, which is a white spots on your teeth, decay, inflammation of the gums, which is gingivitis, plaque buildup, calculus buildup, and it's also going to benefit you because you're going to be able to have good retention on your clear retainers whenever you get them delivered after your braces are taken off. For example, if you have your braces taken off and your gums are really red and puffy because you really weren't such a good brusher, you have a lot of plaque buildup, whenever you take moldings of your teeth, your retainers are going to be molded as how your gums are, and you're not going to have good retention. Therefore, you are at a risk of possible relapse within the next 30 days when you come back, or if you return to get some new retention trays. As you can see, this patient did not have a lower bonded fixed 3-to-3 retainer, which is that bar that goes behind your bottom lower teeth. Reason being, sometimes patients usually request not having that retainer bar, but you have to remember, if you do not get it, usually patients request not to have that lingual bar, and usually it's because they just don't want to floss through it, or they find it quite annoying. But you have to remember, if you do not get that lingual bar, if you don't get some sort of retention, those teeth will be at a relapse fairly quickly. And so usually as we age, our bottom teeth naturally just want to gravitate to the midline, and that's a high risk for crowding. So one of the most common things that people ask are, am I going to be hurting? Is it going to hurt when they take the braces off? I'm scared, I'm worried, I don't want to do it. My teeth are too sensitive, which is understandable. So I would recommend to go ahead and take some Tylenol or some ibuprofen for any discomfort or inflammation that you feel like you might experience. Usually, like I said, it's going to be a process. So the next step is taking some impressions of her teeth for the lower retainer and upper retainer. And we're going to go ahead and take a panoramic and a Ceph x-ray. These are post records that we take, some photos, intra and extra oral photos, and that's pretty much it, and her final scan. And stay tuned to the end. We're going to go ahead and show you some before and after photos of this case. I hope you enjoy. If you have any questions or like any of our content, comment below, subscribe, and we'll see you next time. And thank you. We are at 188,000 subscribers on YouTube. That is amazing. I can't believe we are there. We never thought we'd see ourselves there, but it just goes to show without you all, we wouldn't be where we're at. So continue to go ahead and comment below, and we'll see you next time. Thank you and bye.
Like Grace's content and you want to see more, make sure you like, subscribe, and comment down below.
Yeah.